Hi everyone. So there has been some new research coming out within the last couple weeks about the relationship between COVID-19 and schizophrenia. And what they found was that people who are living with schizophrenia are actually almost 3 times more likely to die from being infected by COVID-19 than the regular population. And it's actually the second biggest indicator of mortality besides age. And so in today's video, we are going to be discussing more about what this study entailed, what this research means, and what this means for you. All right, so an article came out on January 27th, 2021, titled "Schizophrenia is Second Highest Risk Factor for Dying of COVID-19 After Age." Reporting on this study was then also picked up by larger, more reputable sources such as WebMD, and we will link to both of these articles in the description below. So basically, they were detailing a new study that was released that looked at health records from 260 outpatient clinics and 4 hospitals across New York City. Of the patient records examined, 7,348 adults had tested positive for COVID-19 between the period of March 3rd and May 31st, 2020. So they then sorted these patients into those with an anxiety disorder, where there was 360 patients, those with a mood disorder, where there was 564 patients, those with a schizophrenia spectrum disorder, where there was 75 patients, and then those who weren't diagnosed with any psychiatric disorder at all. So they adjusted their findings for factors such as sex, age, race, and known risk factors for COVID-19, such as high blood pressure, diabetes, heart conditions, chronic obstructive pulmonary disease, chronic kidney disease, smoking, and cancer. Now, the researchers did not find an association between anxiety or mood disorders and death from COVID-19, but they found that people with schizophrenia were about 2.7 times more likely to die from COVID-19 than people without that mental disorder. And this is the second highest risk factor after age. So much evidence has been produced showing that people with schizophrenia have shortened life expectancies by as much as 20 years on average. Now, this decrease in life expectancy, however, is thought to be mostly due to other medical risk factors and behaviors that typically accompany schizophrenia, such as obesity, heart disease, and cigarette smoking. Now, in this study, people with schizophrenia still had a higher risk of mortality from COVID-19, even with the authors having adjusted for these types of conditions. So previous research has found that people with schizophrenia can have altered immune responses and variations in the genes that regulate the body's immune response to infections. This is why there is some speculation stemming from this study that either the illness itself or the medications typically used to treat those with schizophrenia are somehow disrupting the immune system, thus leading to the higher mortality rate. Now, I was initially kind of skeptical when the study came out because of the really small and limited sample size used. There was a very low number of patients with schizophrenia, I think it was just 75, and data was also lacking about patients' psychosis medications. Also, the study only examined patients who had access to treatment at the NYU healthcare system, and it was collected during New York City's peak outbreak when mostly high-risk and symptomatic people were being tested. So right now, the authors of this study are now conducting more research to determine whether there is a biological reason for why patients with schizophrenia may have a higher risk of mortality. They're also advocating that people with schizophrenia should be among those prioritized for vaccines. Now, I want to note that living through a pandemic with all of the fears and restrictions it adds to daily life is a very stressful thing to be going through. Stress is known to make symptoms of mental illness, especially schizophrenia, worse. And so by no means do I want to place more stress on anyone by reporting on these study results. We just thought it was important to share these findings to encourage everyone, but especially those living with schizophrenia who may be at a higher risk of mortality from COVID-19, to take all of the recommended precautions such as mask wearing, social distancing, hand washing, and getting the vaccine as soon as it is available to you. So we will be following the development of this research as it comes out, and that is definitely something that we want to be doing more of on this channel is sharing current research that's being done around schizophrenia. So if you want to keep up to date with this story, as well as hopefully more research around schizophrenia, make sure to subscribe to our channel so as not to miss anything. All right, so that is the gist of what is currently known around the relationship between COVID-19 and schizophrenia. Hope you and your loved ones are keeping safe and staying as well as possible through this stressful period. Thank you so much for watching, and as always, wishing you and your loved ones good health. See you in the next video. Bye.